Before you walk into a patient's room and before you start assessing them, you want to wash your hands because that's the most important thing to do. So I'm going to go through the steps of how to do that. First, you want to have your paper towel ready so for when you're done and you can grab it easily. Then you're going to turn on the faucet. You want to make sure you use warm to hot water because the hot water will kill the germs. So I'm going to turn on the faucet. Okay, then you want to keep your hands low in the sink and you want to go from your wrists to your fingers and let the water just fall off. And you want to do that so it goes from the cleanest part of your hands to the dirtiest part, and you just want to let the water just fall off. Okay, and then you're going to get some soap and you're going to run the soap all along your hands, and you still want to continue to keep your hands low in the sink so you're not splashing anything anywhere. And you want to go between your fingers and on the back of your palms and all the way up to your wrists. And then you want to scrub your nails into the palms of your hands. You want to do this for 15 seconds, and remember that friction is the most important thing to kill germs. And if you want to have a little fun, you can also sing the happy birthday song twice. Okay, after you are done, you're going to rinse it off and continue to go from the wrist down to the fingers. And also continuing to keep your hands low in the sink. And then when you're done, you want to make sure you don't flick your hands. And you're going to grab the paper towel while the faucet is still on. And you want to thoroughly dry your hands. And make sure that they are completely dry. You might need to grab another paper towel. And then after your hands are completely dry, you're going to use that same paper towel to turn off the faucet. And then you're going to throw it out. Hello, my name is Victoria and I'll be your nurse today. May I ask for the reason that you're here today?
Physical.
Physical? Okay, is this for school?
Yes.
Okay, and do you have any concerns or anything?
Nope.
No? Okay, have you had any past operations or injuries that we should know about?
Nope.
Any allergies?
Nope.
Are you taking any medications currently?
Just a multivitamin.
Multivitamins? Okay, and do you have any family history that we should be concerned about?
Nope.
No? Okay, then I'm going to take your height and weight over here, okay? Okay, I'm going to take your height now, so I'm going to ask you to please take off your shoes. Okay, and I'm going to ask you to turn around and back up against the wall and stand up nice and straight. Don't pick up your chin. I'm going to use this flat. Okay, and it looks like you are about 63.5 inches, so that would mean you are 5'3.5". Okay? Okay, to take your weight, I'm going to ask you to leave your shoes off, and we're going to calibrate the scale to 0. I'm going to ask you to step on the scale, please. Okay, how much do you think you weigh?
Probably about 120.
120? Okay, so I'm going to move this to 100, and I'm going to move this to about 118. So you're 118. Okay, let's step up the scale. Okay. Okay, I'm going to take your temperature now. Have you had anything hot or cold in the last 30 minutes?
No.
Have you eaten any gum or candies or smoked any cigarettes recently?
No.
Okay, if the patient has answered yes to any of these questions, you're going to wait 30 minutes before you try to take the temperature again. Okay, I'm going to ask you to open up your mouth and lift up your tongue. Okay, and I'm going to put this into the sublingual pocket and close your mouth, bite down. On a digital thermometer, you're going to wait till you hear the beeping, and then you're going to take it out, and it looks like your temperature is 98.6, which is the gold temperature, and the normal range of temperature is 96.4 to 99.1. Okay, I'm going to take your pulse now. I'm going to take it on your right hand. And I'm going to put 2 fingers on the radial artery. I'm going to put your arm across here. And I'm going to take your pulse for 30 seconds. Okay, and your pulse is 34 and 30 seconds, so that means it is 68, which is in the normal limits of 60 to 100. And while also taking the pulse, you want to measure the rhythm, which is regular, the force, which is 2+, and the elasticity, which is spongy. Also, when you take the pulse, you want to take the respirations too, so the patient doesn't know you're counting the respirations and they won't start breathing irregularly. Okay, and her respirations were 8 for 30 seconds, so that would be 16 for a minute, which is in the normal limits of 10 to 20. And you want to watch that she's not using any accessory muscles and that she's sitting up nice and straight. You also want to look for symmetrical expansion where her chest is going in and out equally. Okay, I'm going to take your blood pressure now. Which arm would you like to use?
My left.
Left? Okay, I'm going to put it up on the table and I'm going to make sure that your brachial artery is in line with your heart. I'm going to roll your sleeve. Okay, now I'm going to take a cuff and you want it to cover 40% of the arm, which if you measure it, it does. You also want it to cover 20% of the width, so you want all the Velcro to be covered. You want to put it 2 fingers above the elbow and line up the artery mark with the brachial artery. Okay, you're going to listen with the diaphragm of the stethoscope. You're going to put it onto the brachial artery. Feel for the radial pulse. You want to feel that, and then you're going to pump up the cuff until you can't feel the pulse anymore, and then you're going to pump it 20 to 30 millimeters past that. Her blood pressure is about 100/70, which is a little low, but that is okay. The gold standard BP would be 120/80.